What I like about the OR is just like the controlled environment and being able to have like a hands-on involvement in the care of the patient. Anyone who would need a brain or spine surgery would be a neurosurgical candidate, and we would be seeing them either in the hospital on a more urgent or emergent basis, or in the outpatient setting where they may be considered for surgery, or we may refer them to other specialties. I would most want patients to know that I care about their outcomes, and I want to educate them and let them know what to expect with surgery both before and after, and how to transition back into their normal routine after they have the surgery.